Welcome. We're glad you've joined this program. Each month, we'll send you a short video with tips to prevent or manage diabetes. We encourage you to watch these videos, try the suggested strategies, and participate in the weekly calls from your community health worker. We hope these resources will support your health and well-being. Our team is led by 6 CHW instructors and a physician who provides training and ongoing support to your CHW. We have helped thousands of individuals with and at risk for diabetes live healthier lives by connecting them to healthcare. Hearing that you have diabetes or that you are at risk can be concerning, but becoming informed helps you take care of your health and prevent complications. There are several factors that increase the risk of developing diabetes. The more risk factor a person has, the higher their risk. One of the risks is being Hispanic or Latino. 1 in 2 adults will develop diabetes. Being 45 years of age or older. Having close family members with diabetes. Low levels of physical activity. Overweight or obesity. One of the most important factors. Let's look at why. What happens when I eat? When we eat, food is converted into a type of sugar called glucose. Glucose itself is not bad. The body needs it for energy. After eating, glucose enters the bloodstream, and this is normal. When sugar enters the bloodstream, the body produces insulin. Insulin works like a key that opens the cells so sugar can enter. Inside the cells, sugar is converted into energy that we need to live and function each day. Sometimes insulin cannot properly open the door to the cells. Excess body fat can make it harder for insulin to work correctly. When sugar does not enter the cells and it stays in the bloodstream, blood sugar levels rise and the body does not feel well. Even after eating, we may feel tired because our cells are not receiving energy. This can make us feel irritable or uncomfortable. We may experience a dry mouth, feel very thirsty, and need to urinate more frequently. If body fat causes high blood sugar, how can we lower our blood sugar? By reducing body fat. Insulin is the key that helps sugar enter the cells. If the key does not work well, sugar cannot enter the cells. However, moving more and eating healthy foods helps reduce excess body fat. When there is less excess fat, sugar can enter the cells more easily and provide us with energy. What are the possible complications of diabetes? Diabetes can increase the risk of health problems such as kidney disease, amputations, heart attacks, strokes, and vision loss. The good news is that many of these problems can be prevented or delayed when blood sugar levels are kept under control. Some people with diabetes say, "But I feel fine." This can be true, but often the damage of the body happens very slowly. Little by little, our health gets worse and we may not notice. Because the change is slow, we get used to how we feel and think we are fine. But the damage keeps happening and problems can occur over time. To illustrate that slow but lethal deterioration, let me share this story about a frog. Do you know what happens if you put a frog into a pot of boiling water? It jumps out right away to save itself. But if you put it in cool water and heat it slowly, the frog stays in the water and doesn't notice the danger. The water eventually boils and the frog cannot escape. This can happen to us with diabetes. We do not feel extra sugar in our blood. Over time, our organs can be damaged without us noticing. By the time we feel the effects like losing sight or having a heart attack, it can be too late. So do I have diabetes? How can we know if we don't feel any different? The most reliable way to know if you have diabetes is to see a doctor for an A1C test, which shows your average blood sugar level over the past 3 months. You do not need to fast for the A1C test. You can eat before the exam. An A1C between 5.7 and 6.4 indicates a risk of developing diabetes. This is a good time to make lasting changes in eating habits and physical activity. An A1C of 6.5 or higher indicates diabetes. Remember, if your A1C has ever been 6.5 or higher, you have diabetes. If your number is now lower, for example 6.2, this may mean that your diabetes is well controlled due to lifestyle changes or medication. Do you know your A1C level? Knowing your A1C is an important step in managing diabetes. If you are under 65 years old, the goal is to keep your A1C below 7 to be considered controlled. If you are 65 or older, the goal is to keep your A1C below 7.5 to be considered controlled. If you take diabetes medications and your blood sugar is under control, do not stop taking your medications without talking to your doctor. Medications help keep the blood sugar levels within your target range. Even if your blood sugar is not perfectly controlled, every point closer to your goal lowers your risk of complications. The farther you are from your target, the higher your risk. Your medications are very important. They help lower your A1C and protect your body. However, medications alone do not cure diabetes. Healthy lifestyle changes are also needed to prevent serious complications. If you have trouble understanding your dosage, getting to know your medications, or if you have any questions, you can talk to your community health worker. They can help you build the habit of taking your medications regularly and support you in staying healthy. Your CHW is here to help you with questions about your health. CHWs are trained in diabetes and work with your doctor to give the best support. Patients who work with a CHW usually improve their health. When you joined the program, you filled out a survey to tell us about your needs. Your community health worker will use that survey and your weekly talks to help connect you to care during this program. Your CHW is here to help you connect to your medical care, to give you social support. This matters because your community health worker will help you set goals to build healthy habits related to nutrition and physical activity. And this will also help answer any other questions you may have. And with moral or spiritual support, because personal beliefs and values influence how a person faces challenges and makes health-related changes. Strengthening confidence in one's ability to overcome difficulties can be part of preventing or managing diabetes. Your community health worker can offer support and a listening ear in this area in a respectful and voluntary way. We want you to rest assured that we will always respect the trust you have in us. Our goal is to help you reach your goals. Thank you for being part of this program. We are here to help you, and help is just a call away. So if you haven't contacted your CHW yet, call or send a text message using the same number you received this video from to get in touch. Thank you.